so today what we're going to do is put everything together, and Will had a great idea to make it sort of a home exercise program, hitting on the things that are important, that are necessary. So starting with that, we're going to be on the floor, starting laying down, but I want you to remember the principles: breathing through the rib cage. Okay, inhaling through your mouth, expanding that rib cage up to the sides and back. Axial elongation, lengthening the spine. Using your TA, that deep abdominal muscle, for the core stability, and moving your limbs off a stable core. And then the alignment, keeping the head, shoulder, rib cage, pelvis, hips and knees and feet all lined up. So we're thinking of all those principles. In addition, thinking of the principle of articulation, one vertebra at a time, distributing the motion throughout the spine. So we're not just hinging at one place. And then thinking about where we're getting that spinal movement happening at. So as we go through these exercises, I'm going to give you variations on a theme to make them harder or easier. So we're going to start down on the mat. Okay, so everybody get down on their mat. And first, just get yourself organized with that alignment, relaxing the chest, shoulder blades gently back and down. Find that neutral spine. Remember that hand triangle we talked about in the beginning. So get your neutral spine position, feet on the floor. And we're going to start out with a spine curl bridge. So breath in through the rib cage, exhale, tailbone to the pubic bone, and articulate up one vertebra at a time. This is a great one to start your program out with, and then breath in, exhale, start at the top and come down one vertebra at a time. Because what you're doing is warming up that spine, or getting nutrition. I call this nutrition to the spine. Exhale, tailbone to the pubic bone, and then peel up one vertebra at a time. You're trying to get, even though you may not get each one moving individually, that's your mental thought process. And then down. You can use the cue that your spine is like a strand of pearls, and you're dropping one down at a time. Use your hands, be your therapist or Pilates teacher. Feel where that movement's happening. I'm going to do a couple more. Breath in, exhale, articulate up, peeling up. I'm using my abdominals to help me get that one vertebra up. Exhale and come down. And last one here. Breath in, exhale, tailbone to the pubic bone, L5, L4, L3, L2, L1. I come back up to about my thoracic spine. Then breath in, exhale, start at the top vertebra. Have it come down first, and then one down. So it's just a nice warm up through there. Now, for me, as a physical therapist, one of the most important things is getting that lumbar stabilization. So we're going to revisit getting the TA coming on. So your feet are on the floor, you're in neutral spine position. Breath in, exhale, tighten those muscles in your pelvic floor in between those two hip bones. And now you're going to bring one leg up to tabletop, second leg up to tabletop, keeping my neutral spine position. And now you're going to do toe drops. So it's happening at your femur, your leg is coming down, touch your toe on the ground, and bring your leg back up. If you can't get all the way down to the ground without your back losing its neutral spine, you're just going to make it a smaller movement. So this is a nice way to get your transverse abdominis kicking in, feeling that stabilization. I'm trying to have the axis of motion be at my hips, not in my lumbar spine. I'm going to alternate here and do a few more. I'm breathing, keeping a light lower abdominal contraction on. Good, one more each side. And then both feet on the ground. So a progression of that really isn't a Pilates one, but is more a physical therapy one, but it's the same principles, is a dead bug. Okay, so this would be a progression of that Pilates toe drop one. You're going to take a breath in, exhale, engage the pelvic floor, lower abdominals, legs come up to tabletop position, arms straight up. And then you're going to do an opposite arm and leg extension, okay? So I'm going to reach out, and back. Okay. I extend my leg out to where I can, keeping my neutral spine on. I'm remembering to keep my rib cage down. Sometimes when my arm goes back over my head, my rib cage wants to pop out. So I got to think about that. If you find this one's too hard, you would go back to just doing the toe touch one. But the goal of this one, so on all these exercises, I want to give you the goal of what we're trying to do. We're trying to engage the core, work on that lumbar stability. One more each side. Bring both knees into chest and just stretch there a little bit. So those were your lower abdominals. Upper abdominals you're going to get with chest lifts. So we'll go through about 4 variations you can do here. You're going to find your neutral spine position, hands behind your head. Remember to lengthen your spine. Think of your tailbone reaching away from your head. You're going to take a breath in, exhale, look down, nod your chin towards your chest, and lift up just about to the bottom of your scapula or shoulder blades, and coming back down. So this is getting more your rectus abdominis, okay, your upper abdominals. And it's not quite, that'll give you a nice sort of the washboard kind of look there. But it's not as important as the first muscle we were working on, the transverse abdominis, for stabilization. Okay, one more here. And down. So now we're going to add in obliques, and then I'll give you a harder way to do this. So oblique wise, we're going to come up and then rotate. Okay, so my rib cage and then back down, curl up, rotate, left rib going to the right hip and back down. Curl up, think about where that rotation is happening in the spine. Okay, from about your bra strap up. And curl up and rotate. So the obliques go from your ribs down to your pelvis. Let's do one more each side, and then we're going to progress this. Curling up, rotating, back down, curl up. I'm not pulling on my neck. I'm thinking about my head alignment over my shoulders and down. Okay, so if that feels great, you can keep with that. If you want to progress it, we're going to go to tabletop position, okay? So now when I come up, I'm going to be reaching my right rib cage, elbow towards my left knee. So breath in, exhale, and my opposite leg is going to go out. If you have the strength in your neck, you're feeling good, you're going to keep your head up as you do a little bit of that twist and then extend the opposite leg. Again, focus on where you're moving. Rib cage to the opposite hip. One more each side. Good. And bring your knees in towards your chest. So that was all a lot about your abdominal rib cage area and rib cage and trunk strength through there. We're going to do a single knee pull now and classic Pilates one. And it's working on your abdominal strength, but also your hip mobility. So get yourself organized, neutral spine. Bring one leg up to tabletop, second leg up to tabletop. So what you're going to do, you're going to curl up. You're already using those muscles. Bring one knee towards your chest and pull, pull. And then switch. So I feel my abdominals working. Keep me in this curled up position. But I'm also working on stretching out my hip here, bringing my knee to chest, getting a little bit of a buttocks and glute stretch. One more each side. Good. Knees to the chest. You can roll your back round about a bit. Put a little stretch. So now we're going to do some hip mobility work, but it's also core stability. It's the supine leg circles. Before we do that, I always like to give a stretch to those hamstrings. So one thigh up, hands behind your thigh, and then just extend your leg. Remember those hamstrings attached to your ischial tuberosity and below your knee. We're going to do 4 knee extensions here, lengthening the hamstring. So I want to think about it lengthening. I keep my tailbone down and reach my heel away from my buttocks to feel that elongation from both ends of the hamstrings. That's number 4, and now 4 little calf stretches. So just pulling the toes towards the nose. So we've got that leg stretched out a bit, and we're going to do circles. The goal is you're going to be trying to keep a neutral pelvis and lumbar spine and move at the hip. If this is hard for you to do here, you can do it with your knee bent. So breath in as my leg goes across my body, down and out and up. The motion's happening at the femur joint, hip joint. You can imagine you're painting a circle on the wall. The size of the circle depends on the mobility in your hip. So go to where you can without your back rotating up. One more. And opposite direction, out to the outside, to inhale, down and up. Two more. Bring that knee into your chest, give it a nice stretch, and straighten it out. Okay, I'm going to do my left leg, grab underneath my thigh, and then extend the leg up. And let it come down. This is my active hamstring stretch. Tailbone stays anchored down. Heel reaches away from the sit bone. Good. One more. And now a few ankle pumps, so toes coming towards the nose. Okay, so you've got that leg limbered up some. Get your neutral spine. Use your fingers on your hip bones to see if you're trying to stay stable. Breath in as you go across your body, down and up. Make the circle the size that works for you. My left leg's stiffer. I can't make as big of a circle on this side. Feel that you're staying anchored in your sacroiliac area. One more. And then out to the side, down and up. So pelvic, lumbar pelvic stability, hip mobility is what we're working on. Pay attention, I was jutting my chin out. I was losing my alignment in my head and neck area. So see where your head and neck is. One more there, and then come in and stretch. Okay. So one more on our back. We've been doing a lot of flexion, firing up all the muscles that curl us up. We want to work our glutes and our hamstrings here some. So not so much focusing on the spine curl part of the bridge, but coming up into a straight hinge at the bridge. Okay? Feeling that the glutes are firing, pressing my arms into the ground, and then coming back down. Now for a lot of us, that's pretty easy, okay? So the next progression, and I'm gonna do that, if you're comfortable doing that, just stay with the bridge. Otherwise, you're gonna come up into a bridge, push through your heels, push your arms into the table, and now you're gonna shift your weight and extend one leg. Feel the left glute fire on my weight's on my left side, then come back down, foot down, shift to your right, squeeze your right butt, straighten your left knee, and come down. Shift, feel what's happening at your pelvis. Are you keeping your two top hip bones level? That's your goal here as you're doing this. I'm also using my arms, okay? When I shift onto my left leg and extend my right leg, I'm pressing with my right arm. That's that posterior sling we talked about the other day. Good. Glute, lift the butt, push with your arms, have your oblique muscles coming on. There's a lot of muscles working to give me my pelvic stability as I shift and extend my leg. Good, let's do one more each side. Good, and now you can articulate down one at a time. Okay, we're going to shift into sideline position. You can either use pillows, towels, arm to support your head. We're going to let the legs rest here for a bit, and we're going to do the book openings. So my hips are stacked on top of each other. I'm not going to be moving from my waist down. It's my upper body that's going to do the rotation. So breath in, exhale. I start floating my arm up. I'm moving through the thoracic and cervical spine, getting that rotation. Breath in, exhale. As I come back, I'm using my obliques. My ribs are coming back towards my belly button, towards the middle of my body. Breath in, exhale, float and lift. This is an important one. You need rotation through that thoracic spine. And again, we start tightening up. By age 16, we start losing the flexibility in our thoracic spine. So it's work to keep it going. Not so much work, but it's attention. You gotta move it or it's not gonna move. And you'll spare your lumbar spine by getting more rotation through your thoracic spine. One more time as we come back. And breath in, exhale, lift and rotate. And once we're here, let's get a nice stretch. I like to straighten out my bottom leg, bend my top leg a little bit more, take my bottom hand and give a little stretch there and take 2 or 3 deep breaths. Just a nice stretch. Doing it in this sideline position is really nice because my spine isn't loaded, so I can get more rotation through that thoracic spine. And then come on back. Okay, so now back down to some hip mobility work. And again, you have options. We're going to do some leg lifts here, getting that gluteus medius. Options are just having your head supported on some pillows or towel roll on your hand, or a little bit more work where I have to, because I have to pay attention to my shoulder stability, I could be in this position here, okay? What I want to do if I'm in this position is get my elbow underneath my shoulder, scapula back and down, lift my waist angle. I'm going to lift my leg up and reach it up and back a little bit and down. Exhaling on the upswing. So this is your gluteus medius muscle, really important with walking, so that you walk with a nice stable pelvis. If it's weak, you get that sort of festus limp. When I'm doing this, my leg is right off of my body, or maybe even a little bit back behind your body, to isolate that gluteus medius muscle. You should be feeling it in the back lateral side. Keep length through your waist there. Let's do a couple more. So an important muscle to keep strong, okay? And again, choose your head position. I'm going to go down onto my forearm here, or onto my arm. And now we're going to do some swinging the leg forward. So even when I'm down on my arm and I'm not up here, I'm still thinking about lifting my waist angle, nice stable pelvis, sweep your leg forward, exhale as you pull back behind you. Forward, I'm getting an active stretch of my hamstrings. Exhale as I pull back, that's my glute. Put your hand back there, feel that glute fire. Reach back behind you. Inhale, coming forward. Exhale, pull back. Inhale, forward. Exhale, pull back. So think what's happening in my mid area. I don't want to be rolling around in my trunk. I want to keep that stable. If I can't do it, I'm going to put my hand down here to help me stabilize. If you can stabilize without it, hands off the ground. And pull back. Go forward. Exhale. Pull back. Fire that glute. 2 more. Forward. Exhale. Pull back. Forward. Exhale. Pull back. Great. Okay, we're going to get on to the other side. So get yourself organized, choose your position for your head, neck, shoulder. Okay, I'm going to do on my forearm this time, lifting my waist angle, lengthening my spine, lift my leg up off my pelvis. Okay, and now we're going to do the gluteus medius sideline leg lifts, and then come down. So I started scrunching my ear to my shoulder, so I have to think, stabilize through the shoulder if I'm on my forearm, keep my neck long. And I'm wiggling, so I'm going to put my hand down to stabilize better. Keeping my leg in line with my body. Let's do 2 more. Okay. Now we're going to do the leg pulls. Okay, so my legs up. Whoops, I got to get my pelvis stacked on top of each other. Bringing my leg forward. Exhale, pull back. Swing it forward to where you can without you losing your pelvic position. Reach back behind you, fire that glute. Lift your abdominals up and in. Reach back behind you. And when you're going back behind you, pay attention that it's happening at your hip. You don't want to keep going into your back. So as far as your hip will go without pulling your back behind you. Two more. Okay, I forgot the book openings on this side, but we're going to do that so we can rotate to both sides. I'm going to grab my towels here. So hips and knees are bent, stacked on top of each other. They're staying stable. We're going to get the rotation coming around through the thoracic spine. So breath in, exhale, float the arm up, follow it with your head and neck, get that rotation, but keep the legs stacked on top of each other and the pelvis stacked on top of each other. Breath in, exhale, and come on back. Breath in, exhale, float the arm up, keep the legs stacked. So functionally where this comes into play is when you're reaching for your seatbelt in the car or you're reaching for something in the back seat. You want to get that thoracic rotation and not just have your arm pull back, okay? It's going to be less strain on your shoulder if you can do it and add in that thoracic rotation. Good. And come on back. As I'm coming back, I'm thinking about my obliques, those muscles we fired up in the very beginning. They help pull my ribs towards my midline. One more. Float the arm up. Extend through the thoracic spine. And then once we're here, we're going to straighten your bottom leg. Bend the top leg. Top arm holds onto that knee and just take about 2 or 3 breaths. So what's your comfortable stretch rotation? And as I return on the exhale, float the arm up, bring the rib cage back to midline. Okay, so we're going to go on to our stomachs now. So Pilates is a lot of flexion, a lot of stuff on the front. We need to fire up that back. So there are some Pilates exercises for that. If you're uncomfortable, put a pillow underneath your stomach. And when we're on our stomach, it doesn't mean that we let our tummies go, okay? We're using our abdominals to pull that belly button away from the mat. And first we're gonna just do some little low puppy press ups. So I'm here, getting my neutral spine position, hands about head or shoulder position. I'm gonna take a breath in, pull up my abdominals, lift my head, My gaze is going to go along the floor to the baseboard to the bottom of the wall opposite me. Thinking about my elbows reaching towards my heels and then coming down. And go up to where it feels comfortable. You know, you're not going to go into pain. Breath in, exhale, navel to spine. My head lifts up, my gaze goes along the floor to the baseboard, to the opposite wall. I'm keeping my the bottom of my ribs down. I'm not going to go up further than that. This is through your thoracic spine that you're getting the extension, and then down. I'm paying attention to alignment with my head. Breath in, exhale, pull up the belly, push the hands into the ground. Elbows reaching towards my feet. My head stays in line with my shoulders. I don't cock it back up. Okay, I keep a long spine as I'm doing this. And back down. We're going to do 2 more of these. Breath in, exhale. Lift the head, push the hands into the floor, elbows towards the feet. Lift your sternum, your heart's shining across the room. And back down. 1 more. Breath in, exhale. Pull up that belly away from the mat. Lift the head. Push into the floor. Lift the heart or the sternum. Shine it across the room. And then coming back down. Okay? So good to get that extension. We spend too much time forward bend. So that's, we're going to do a more active extension where we're going to get it both in our legs and our upper back area. So this is the dart. So bring your arms towards your side, okay? Bring your legs together a little bit of squeeze of your inner thighs, little heels together. Breath in, exhale, lift the head. Slide the shoulder blades into the small of the back and just lift the legs up to where you can, just a little tiny bit off the ground so your feet aren't touching the ground. And then come on back down. So you're firing all your extensors. Breath in, exhale. My belly goes towards my spine. I lift my head. Scapula slide into my low back. Lift the feet and the knees up off the table and come down. Try and keep those legs together using your inner thigh muscles. Breath in, exhale. Lengthen the spine and then lift the shoulders, legs, squeeze the butt. Feel the back side of the body working and back down. Breath in, exhale. Abdominals on, lift, hold, and come down. 1 more time. Breath in, head reaching away from the tailbone as I lift, squeeze my butt, shoulder blades pulling into my back pockets, and then come back down. So a little bit more work than pushing up with your hands, but you're firing all those muscles, which is really great. So from here, let's come up onto hands and knees and do a little bit of a child's pose. Stretch out that back. Okay, quadruped position. One of my go-to that's really good to keep in your home program is the quadruped opposite arm and leg raise. So I get in my quadruped position, hands under the shoulders, knees under the hips, play around with that pelvis and find that neutral spine position. Nice broad back, okay? I get that by pushing my pinkies, my hands away from each other. Then I'm gonna lift my opposite arm and leg. and then come on back in. Stabilize, lengthen the spine, and then extend the opposite arm and leg. So my arm and leg are extending off a stable body. So what this is good for is your shoulder blade stabilization. When I shift onto one leg, one arm and one leg, I'm making sure my scapula is staying on my rib cage. I'm keeping my ear away from my shoulder, so I get scapula stabilization. I'm using my glute. I'm kicking as I extend back, my glute's turning on. And I'm using all my trunk stabilizers through here to keep my trunk stable. So really great exercise to keep in your routine. And you don't have to do a ton of them, okay? You're just training the body, motor learning. One more each side. My arm and leg are going off a nice stable trunk. So if I had 2 glasses of champagne on my back, I'm not going to spill them. One more. And back. I'm going to throw in, we're getting short on time here, but another one that I like to put into the home program, and you can do it either on your extended arms. If this is uncomfortable for you, you can come down onto your forearms and work doing a little leg press, okay? What I'm working here is my glutes. So I lift my thigh up, I think about pressing my heel or my foot, making an imprint onto the ceiling. Firing that glute. Again, I go to the point where my hip will go, not going into back extension. Good, one more. Shift, get yourself centered, lengthen the spine, nice broad back, lift the other foot up off the ground with the knee bent, press the foot up towards the ceiling and back down. Think about firing that glute. You can even take your hand and poke it a little bit. Say, are you turning on? Two more. Good. So one other one, and you can go into a child's pose and stretch for a second, that I would keep in your repertoire is some form of plank. And you can pick and choose how you want to do that plank. Forearm plank, you're going to be getting more abdominal work. With your hands on the ground and elbows extended, it's more shoulder stabilization, but still some core work. Let's start with the easiest one. I'm just going to quickly go over these because we're running out of time. You know, if planks are hard for you, this is where you're going to start. Okay, my knees are down on the ground. I just lift my pelvis, abdominals up and hold here, okay? Not so hard. Harder is going into a plank on my toes. So I'm here, pull up my arm, pull up my abdominals, lift my hips up, and what I want is my butt and my shoulders to be in line there. I don't want to be sagging. I don't want to be arching. I want to make a plank and holding here. Okay, progression from here would be to do a leg lift. And that's sort of hard, staying stable, but just giving you progressions to work into. Great, okay. The other plank is to be on your hands and knees. It's to be on your hands, on your knees, lift up, okay? Plank position here, nice broad back. So here, I have to think a little bit more about my shoulder blade, length through my spine, okay? And if you want to make this more difficult, you're going to bring a knee toward to your hand. We're just going to do 3 of these on each side. Last one. This will be 4, I guess. And then come down on your knees, back into child's pose. Couple of deep breaths there. So one more thing for your repertoire at home is getting some side bending, okay? We don't do this functionally. This isn't a lot in our life, but we need to have some length through here. So you can choose your sitting position. Again, I like the Z-sit position or the mermaid position because I'm working on my hip mobility. But you can be sitting cross-legged to do this. You can be with your legs slightly bent out in front of you. I'm going to do this position because I kill 2 birds with 1 stone. I get my hips here, anchor my hips down, arms out to the side. Breath in, exhale, side bend over. I can put the side I'm bending towards, my hand down, push into that hand, reach my sit bone down to the ground, and then come on back up. So where that rotation, where that side bending is happening is right about at your lower ribs. That's where most of the motion happens. Breath in, exhale, hand goes down, reach the sit bone down, keep the sit bones heavy. No matter what position you're in cross-legged position, you're still thinking of the sit bones staying down and then coming back up. And breath in, exhale, side bend, reach. It's like you're making a nice rainbow. Again, trying to distribute that weight. I'm going to switch my legs because now I'm working on my other hip flexor, okay, my hip rotator on my left side. Internal rotator is getting stretched, my external rotator on my right side now. If you're cross-legged, just stay there and you're going to side bend to the other side that you were doing. I'm going to my right side. Hand down, sit bone reaches away. That nice side bend. And come on back up, tall. Here I'm remembering my axial elongation. Lengthen my spine. Remember that barber pole image? Get tall and then side bend. And coming back up, breathing in. Get tall, anchor in those sit bones, and then get that nice side bending. Great. And come on back up. Let's come up to standing and do 1 roll down. Nice way to finish off. So, standing, you're gonna find your neutral position. Remember your tripod on your feet, little arch in your feet, getting tall, taking a breath in, exhale, I nod at my head down, look down through my thoracic, my cervical spine, start bending in my thoracic spine, trying again to get that segmental movement, 1 vertebra at a time, coming down to my lumbar spine, really pulling my belly to my spine. Feel where the weight is in your feet. If you're going back on your heels, get your tripod on your feet even as I roll over my hips and get a nice stretch. If I want more hamstring stretch, my knees are straight. More lumbar stretch, I bend my knees. And then coming up, breath in, exhale, slightly bend those knees, drop the tailbone down first, stack the pelvis up, and then articulate 1 vertebra at a time, stacking them up. Get tall, get your alignment. Feel that length in your spine, feel your head over your shoulders, over your rib cage. And then that's how you're gonna be living your life. So I really enjoyed it with everybody. I hope you did too. And if you have questions, concerns, just shoot me an email. You know where I'm at. But, you know, live your life with that attention to your body, because they really work together. And it's just, you're going to be much more powerful if you're aware of where you are in your body throughout the day. Okay?
Thank you